Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Hi, this is Jason Edwards, and welcome to Doc Discussions. I'm here with Dr. Christopher Cronin, a general surgeon. Chris, how you doing today?
I'm doing well.
So a funny thing happened. The other day I was reading a book that was put together by Reader's Digest called Getting the Most Out of Life, and it was published in 1948. And I opened the book, and the very first story is by a guy named AJ Cronin, somebody you know well.
Well, I can't say I knew him real well because I really only met him 4 or 5 times because he lived in Switzerland, and he passed away, I think, when I was a senior in high school. But yeah, he was my grandfather. He was an author, also a physician.
Yeah. So the story talked about him, brief synopsis, getting sick. And then he had to it was a stress-induced ulcer, and he had to go out to the countryside. And when he was there, he decided to write a book, and it ended up being a raging success. And then he wrote many, many books. And I think like 19 of them got turned into movies. And so he knew people in Hollywood and the whole thing.
Yeah, he was a pretty famous guy. So basically the way it all started was he was a physician, grew up very poor, got a scholarship, and he chose, it was either going to the ministry or medicine. So he said lesser of two evils. So he picked medicine. And if you read the Citadel, it's a little bit an embellished life story.
Yeah.
What happened was he was a successful doctor, kind of specialized in pulmonary type stuff. And then he got this ulcer, and I guess back then you took 3 months off on a milk diet. That was what was recommended. So he went to some farm, and I've read like a similar anecdote about where he had written half the book, and he just thought it was terrible, and he just threw it in the trash can, and he took a walk, and then he runs into this guy who's like clearing a field, trying to make it into pasture land. It was like a bog or something. And he kind of knew the guy, and they started chatting. He told him, I just threw away. The book was terrible. And he's like, look, I've been working on, my grandfather worked on this field, my father, I'm not giving up. And he kind of thought about that and said, and he pulled it out of the trash can, and he worked it. And then he sent it to a publisher, and I guess he kind of forgot about it. And then they liked it. And it was very successful, sold, millions of copies. And so then he said, forget medicine, and he wrote a few more books, and then he published the Citadel, I think, 4 or 5 years later, and that was a huge success.
Yeah, it reminds me of, there's a book by a guy named Stephen Pressfield who wrote Bagger Vance called The War of Art. I think it's a play on The Art of War by Sun Tzu. Sure. But the book just talks about, it's when you create art, you're putting yourself out there, and whether it's music or literature, you're putting yourself on the line for people to criticize you. And it's kind of a Teddy Roosevelt man in the arena thing. It's easy for people to sit in the stands and criticize something, but it's very hard to create work, and it takes courage.
Absolutely. Well, the Citadel was very critical of the British health system.
Yeah.
So if let's say you go on Amazon and you read the little paragraph about what the Citadel is, they always say, well, it probably helped bring about the National Health Service.
Yeah.
And I'd heard that, but it seems to be more kind of established.
Yeah, that's what I've read too.
And that came about, so the Citadel came out in 1937, and I think the National Health Service came out in 47. And it addressed a lot of things, that he was kind of brought to light in the Citadel, the lack of training, and then continuing medical education. He's very critical of some of the doctors out practicing weren't really changing what they were doing. They were doing the stuff that they had been doing 30 years earlier, even though the treatments had kind of changed.
Yeah.
So getting back to what you were saying, it's difficult to create something, and then you're being critical of a lot of your peers. So he took a lot of fire for that.
Yeah. The book itself, there are several themes. It's the corruption and unethical practices within the medical profession. Do you do it to make money, or do you do it to make a difference in people's lives, or both? The conflict between personal ambition and moral integrity, He kind of touched on the social class and economic status of healthcare and access to healthcare because he worked in a very poor mining town. And these, he was very avant-garde, ahead of his time, in a lot of these things. And I'd read the same thing, that this was kind of an impetus to ultimately push the NHS over the line, which England is very, very proud of. I remember in the 2012 London Olympics, in the opening ceremonies, they even had like an homage to the NHS.
Oh, really? Okay.
And so I know they're proud of it. In his other books too, he kind of delves into these deep life questions, meaning of life type of thing, and and obviously hugely successful. And these are things I think as doctors we think about too. You can't help but treat patients, and you see good outcomes and bad outcomes and difficult situations, and it can't help but make you think about these deeper meanings to life. And I'm sure that's where he got this from.
Yeah, well, you do the best you can, and even when you do that, everything seems to go right, and then one complication, it can really make you rethink about what you're doing.
Yeah.
And that, one theme in the Citadel was, he was working with a surgeon. He really respected the guy, and he was doing an anesthetic. They didn't have anesthesiologists. You just kind of do a little bit of ether. And so then he finally saw the guy work, and he realized how incompetent this guy was. And that's sort of the big dramatic change he had in the book. He realized, he kind of had the morals that he had started out with when he was going to medical school and the things he wanted to do. And then he realized sort of with that one seminal event that he had changed, and he needed to go back to, his morals and his ideals, when he started.
Yeah.
So, yeah. And I think medicine will do that to you, because, things happen and you take it personally, and you got to rethink about what you're doing.
Yeah, for sure. Did him being a physician push you into becoming a physician, or not really?
Not really. I didn't really know him well enough. He would come over now and again. Like I say, he lived in Switzerland and visit, and we visited him a few times on vacation.
Yeah.
So he didn't really have an impact like that. I guess my mom kind of respected him a lot, and maybe if anyone pushed me into that, it was her.
Yeah.
The short of it was, I got to college, I realized I'm really not good at a lot of things. It's like I'm pretty good at science, and so I started taking some science, the preliminary, and did well and liked it. And so that's the other thing most people don't realize. You go into medical school, you really don't know most people don't really know what they want to do, don't really know much about medicine.
Yeah.
Some guys, dads are doctors, so they know more, but for the most part, you really don't know what you're going to end up doing. And a lot of it's just the mentors that you meet, the chief resident that you respect, or, you have one attending that kind of, you like or takes interest in you.
Yeah.
And that can swing you into what you want to do.
Yeah, I agree. And in fact, I worry about somebody who comes in as a first year medical student and says they want to do this profession because they don't know the ins and outs of it. They're kind of biased in a way that they shouldn't be. And so was that the experience with you? You were in medical school and you did the surgery rotation.
Yeah, absolutely, 100%. I was ortho all the way. I just seemed like a cool thing to do.
Sure.
And kind of like the jockey type doctor. And so I remember I did a rotation with a guy when I was a first year. Didn't really think the guy he was saying the same thing every time. He'd say, we can either grease it or or send you physical therapy. That was the same for anyone with a bad knee. And I was like, yeah, this is boring. So anyway, fast forward, we had these acting internships. I don't know if you did that, where
AIs.
AIs. You did 6 weeks in medicine and surgery that you had to do. And I had done my preliminary in orthopedics, didn't love it. The guy I worked with, the resident, was kind of a jerk and didn't really seem to care that I wanted to do orthopedics. And so I did my surgical acting internship, and I had a guy named Steve Evans who was just outstanding. I was at DC General, which was as tough of a city hospital. I think it's since closed, but it was, bare bones. So we were really needed.
And you took the indigent population?
Absolutely. It's primarily indigent, a lot of trauma, and very few services. So the medical students, we were
get a lot of
drawing
experience.
Blood, we were putting IV, we were doing a lot of stuff.
Yeah.
And
which is great as a student.
Absolutely.
Yeah.
And the patients were appreciative too, because we're taking care of them. And the residents really worked with us. And I remember this guy came in like 30 nights in a row. He had a trauma like every night, and you'd never know it. He was always like teaching. And so anyway, I was like, I really respected this guy. And that's when I was like, I want to be this guy.
Yeah.
And it's interesting because he ended up going on, he went to GW. He finished his training, went to GW, was there for 5 years. And they brought him back to Georgetown. And within like 10 years, he was chairman.
Yeah.
And now he's head of the MedStar, which is like the whole medical system. I think he may have just retired. But
how about that?
Yeah, I had some patient who was a lawyer, and he looked me up and said, "Oh, you went to medical school at Georgetown. You know Steve Evans?" I was like, kind of weird. He was my chief resident. How would you know him? He's like, "Well, I'm a lawyer. I work with him at MedStar. He's head of the whole show." So I guess the guy I picked was pretty good because he became very successful.
You know, talking about him coming in 30 nights in a row, I very much remember my surgery rotation in medical school, and then I did my first year of training in general surgery. It was part of the program, and it's an attitude. It's an attitude and a standard that comes with general surgery. And it's like, don't complain about it. Just soldier on. You might not feel great. You might be tired. But it doesn't matter. The more you talk about, you don't talk about it at all. You just keep going. And I feel the same way. My chiefs, I loved them and respected them. I would do anything for them, and it wasn't that they necessarily did anything for me. I just respected the hell out of the standard that they had.
Absolutely. Yeah. And you always remember those guys.
Yeah.
I remember, when I was an intern, the 5 chief residents we had, some of them I respected more than others, but there was, they had the long coats. It's a little different in surgery. At WashU, we had to wear white pants.
Okay.
So we had basically a uniform and then the short coat until you became a chief resident. So by the time you were 4th year, you were considered a chief on some services. So they let you have the long, but it sort of was demeaning because all the medical, residents had long coats. There's sort of a status thing, but it made sense. Someone explained it to me once that, hey, if there's 5 of us coming up here, they know the guy with the long coat is the guy in charge. So they can just come up to me if there's a problem.
Yeah.
So,
there's a very clear hierarchy.
Absolutely.
That is it's not only an age-based hierarchy, but a competence-based hierarchy, which is very necessary in difficult situations.
Yeah, I think it works really well. I did a year of training in Australia. So my 4th year, chairman called me up, or I guess it was the end of my 3rd year. I was a PGY5 because I did 2 years of lab time. So I did some research, but they had a spot in Australia. So he's like, look, you got like 48 hours and let me know. You can go over there for a year. So I said, what the heck? I'm going to do it. And which is a lot because like you said, there's a hierarchy. I'd been there. People kind of know your level of competence. So if I'm calling an attending at 2 a.m, look, this guy needs to go to the OR. They know me. They'll respect what I have to say. And, you kind of build up your credibility. So it was difficult going over there because they didn't know who I was. But, that worked out. But it's a totally different system because they have what are called registrars. And it doesn't really matter. It's a 4-year training program. They rotate every 6 months on a different service. So you could be start on that battle artillery service as your first rotation. You're obviously not going to do nearly as much, but you're kind of considered the same.
Okay.
So I much preferred our system because there is a hierarchy and it's just, you get better training that way.
Yeah. My wife did a rotation in Africa with other international students, and it's from her perspective, the training was much better in the United States. I don't, that was just her experience as a single person, but she said it was more rigorous, which is good.
I for sure. I remember we had a surgery resident come over from Ireland who had already completed his training. He was fully trained.
Yeah.
And he was maybe like PGY3 level.
Yeah. And out of 5. So
out of 5.
Third year out of 5.
Which is, so
not super functional, but you could
kind of a mid-level resident. Generally a chief resident, at least back when I was training, can operate independently.
Yes.
They don't really let you do that anymore, but you're sort of have reached that level of competency.
Yeah. And I think this, whether it's sports or surgery, reps matter. Your repetitions matter. And the more training you do, the more times you do anything, the better you're going to be at it. Whether it's hitting golf balls like your son, who's an excellent golfer in college, second in state, is that right?
Second in state back in the day.
So whether it's hitting golf balls or doing surgery, reps matter. And this is a thing that's come up with the duty hours restrictions. It used to be kind of take the bridle off of it. There's 167 hours or 168 hours in a week. You work 100 hours and sleep, and eat the rest. And then
they're very strict about that.
They throttled it down to 80.
It's down to 80, and you could be doing a case, and if you're going to violate, you have to get someone to come in and relieve you, basically, which was unheard of.
So you get less reps, which means more people are going into fellowships, which is additional training after the residency. Now, did you do a fellowship for neck surgeries? Because unlike most general surgeons, you do abdominal surgeries, but you also do some neck surgeries too.
Yeah. So when I went over there, I spent, so they rotate every 6 months. I had no idea they're like, well, there's the chairman there was a thyroid expert. So that's Dr. Wells, he was an endocrine surgeon, mainly did thyroid. So he knew this guy just through international meetings. Lee Delbridge was his name. Great guy. Great surgeon. So I really learned a lot from him. But that's all he did. He did thyroids and parathyroids. We did like one or two insulinomas and then a couple adrenals. Okay. And I was better because I had learned from Dr. Brunt. He was doing laparoscopic, and these guys were way behind us.
Yeah.
But that's a whole nother story.
So you were great in the abdomen, but you learned from him.
Yeah. And so at WashU, because of Wells, you didn't do anything until you were a chief resident. So he would have a second year, you'd hold retractors, the chief would scrub with them, and he'd let the chief do the case. So it's like a thyroid at WashU, maybe not at another place, was because, Dr. Wells, the chairman, chief resident every time.
Yeah.
So, and that was your time with Dr. Wells. You had usually it was about 8 weeks, and you were sort of the administrative chief at the same time.
Yeah.
So yeah, we did 6 months, and this guy was super busy. We get every thyroid in New South Wales practically. So we're doing maybe like 10 a week.
Yeah.
We do 6 in a day sometimes.
Yeah.
And then I had my own clinic. He would just send people, getting back to the National Health Service. It's a little bit different in Australia, but similar. They had, sort of 01 and 04. So 01 were the private patients, 04 were public.
Okay.
So he would send those to me.
Yeah.
Which I thought was kind of weird, but that's just the way they did it. So learned a lot about doing thyroid surgery. I think I did over 130. In fact, when I applied to get my boards, they flagged me. They're like, there's no way you could have done this many thyroids and parathyroids. They sent it back to me. There's a typo here. And I said, I had to have Wells, call him and tell him, no, I had done that many. And then actually the second 6 months was even more. I worked with these two guys in private practice, and this one guy was probably one of the best surgeons I ever worked with. This guy could do anything. He did ERCPs, he did laparoscopic, we did Whipples, we did everything.
That's nuts.
And he was a really, patient, good guy. So I was really lucky, the time I spent over there. Because we had, I think, 2 or 3 other residents follow me, and some of them didn't have nearly the experience that I had.
Yeah. Yeah, for sure. And we all owe a lot to our mentors, people we love and respect, for teaching us, how to be good doctors.
Absolutely. It takes a lot of patience to to allow someone to do something. You're watching them. You're still kind of guiding them through the case and everything, but
yeah,
it's, not everyone can do that. It's difficult sometimes. Someone's struggling. You got to let them kind of struggle a little bit, but not too much.
Yeah. There's
you gotta figure it out.
When I graduated, there's a poem written about the SR-71 Blackbird, and which is the fastest airplane. And the kind of the basis of the poem is, as a mentor, you have, even when you want to jump in and help, sometimes you got to let people kind of work their way through it.
Correct.
And that's hard, especially as a new attending to do, I think.
Well, it builds confidence. If you got to help them every time, they're going to lose confidence. You got to be able to kind of do it. And we've got a new, just right out of training, a new associate. And so, we do some hard cases out here, and sometimes she's, wow, this is difficult, and we got to go in there and you got to sort of help.
Yeah.
But you don't want to do too much.
Yeah. And you guys work, your team works together. You just got out of a surgery with one of your partners. And sometimes it's helpful to have another set of hands in there.
Yeah. Having 2 experience. I think that if me and one of my senior partners are doing a case together, it's better than certainly like down at Barnes when you've got you got two really experienced guys been working together for 20 years.
Yeah. It makes a difference.
Makes a big difference. We can move a little bit quicker, and you kind of know each other.
Yeah.
There's always that familiarity. So when you're rotating through constantly all the time, it sort of takes a little time to trust somebody.
Yeah.
And by the time once you build that trust, then they move on.
And it's there with your partners and the techs who help you during the surgery, and the nurses and the anesthesiologist. And that's the nice thing about St. Luke's being a kind of a smaller hospital. Yeah. Well, Chris, thank you for sharing your story with us. You're a general surgeon, and the phone number to your clinic is 314-434-1211. And so if anybody's looking for a great general surgeon, give Chris a call. Thanks for coming on.
Hey, thank you for having me. I really enjoyed it. Thanks.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.